Good afternoon, everybody. It's Dr. Nick Coatsworth with today's Top 3, where I'm going to answer your top 3 questions about coronavirus COVID-19 over the past 24 hours. But before I do, I'm just going to do a daily shout out now. And the second one, I spoke about the comms team a few days ago. And now to the epidemiologists and contact tracers out there. We have a large number here federally, but there's an army of them in the local states and territories, and they're the ones that are calling people who've had COVID-19 or have been contacts and are really trying to break those transmission chains. So they are working round the clock. It's incredible work, and really thanks guys from us here in Canberra.
First question for Dr. Nick. With winter coming soon, will the virus get worse?
Well, look, one of the aims of the government strategy at the moment is to flatten this curve and slow the transmission, but we are obviously going into the winter season, and with winter comes other respiratory viruses and influenza. We actually don't know whether coronavirus is going to be any worse because of seasons, because we just don't know that data yet. But what we do need to do is limit the impact of influenza on our healthcare system at the same time. And unlike coronavirus, we do have a vaccination for influenza, and that will be widely available throughout the month of April. So if you got influenza vaccine in the past, get it again. If you've never had it, we should all be getting it, really, because we have to minimise the burden of influenza at this time of COVID-19. I also encourage you to take steps to help protect yourself by practicing good hygiene and social distancing, as well as getting that flu vaccine.
Second question. Are there some people in the community more at risk of getting coronavirus?
Well, look, I think at this point in time, we need to assume we're all at risk, and equally, we need to assume that we have it and could give it to someone else. And that's about the principle of keeping our distance from each other, and particularly not getting outside when we've got a cold or we're feeling unwell. But there are people in our community who are more vulnerable to severe coronavirus disease, and they are the older members of our community and members of our community that have a range of chronic diseases, including chronic lung conditions, high blood pressure that's not well controlled, or cardiovascular disease. A full list can be found on our website. I'd like to also say, though, that even though the proportion of severe disease in young people is lower, there are still a number of previously well 20 and 30-year-olds around the world, in US and Italy, who have become very unwell. So please, don't be complacent if you're in your 20s or 30s.
Third question. I'm a diabetic type 2. Should I still be working in community aged care? So there are a variety of conditions that we are going to would classify someone as a vulnerable person in the workplace. If you are over 65, or if you are over 50 and identify as an Aboriginal and Torres Strait Islander, then you may have a certain chronic medical condition that makes you a vulnerable person. Those conditions, again, can be found on our website, but specifically with relation to type 2 diabetes. If your diabetes is poorly controlled and you fit into those one of those two groups that I mentioned before, over 65 or Aboriginal and Torres Strait Islander over 50, then you should not be working in an aged care facility. To determine whether your diabetes is poorly controlled, please telephone your general practitioner and have one of our telehealth consultations, and they will give you advice on whether you need to talk to your employer or not. The last message for today, I really want you all to stay at home. It's a difficult time for us all, but there have been some early positive signs. We can't be complacent now. We can't take the foot off the accelerator, and we have to all work together to flatten the curve. Thank you.